uh, abnormality. So when you're looking at postpartum gestational weight gain, and one of the important things that we have in our issues, which we have in our, whether it's in our country or anywhere in the world, is the retention of weight. So one important thing is that how much weight should a woman have in pregnancy. So let's say if a woman is having a weight gain of, of about, for a woman who in a normal, before the pregnancy, again, one of the things which we need to address is the just weight. So pre-pregnancy BMI is one important issue. So if the pre-pregnancy BMI is within the normal range, that is somewhere between 19 to, although the Western books say it's up to 25 is a normal BMI, in Asian countries, we consider 23 as a cutoff point. So 19 to 23 is the ideal BMI for a pre-existing BMI for a pregnant woman before the pre-pregnancy state. So for a woman who falls in this normal BMI in the pre-pregnancy period, we advise them to gain a certain amount, for example, 9 to 12 kgs in pregnancy. Whereas for a woman who's starting birth with a higher BMI, the more higher she is, we advise lesser weight. So somewhere between, let's say, if the BMI is about 23, we advise them somewhere between 5 to 9 kgs weight gain during pregnancy is only permitted, because based on the BMI. So if the woman is underweight, that is, let's say she's starting off with less than 19, then we advise her to go for a higher weight gain. So maybe more than 12 to somewhere between 12 to 15 kgs of weight gain in pregnancy. So gestational weight gain is again an important thing which we have to concentrate. So at every antenatal visit, that's the reason why we have to take the weight and see where it is going. And other thing is, the most important thing is retention of the weight gain in the postpartum period. So many women come to us with the retention, when they complain that they are not losing their weight. That is because that we have somehow it is there driven into the minds of our the older women in our families who say that when you're lactating, you have to eat for two. So that's not necessary. We all know that lactation just needs just another 300 calories extra, which can be gained by even with a glass of milk. So it is important that she controls her carbohydrate and unnecessary foods intake and concentrates on the quality of food rather than the quantity of calories that she is taking. Not only that, it is very important that she combines it with an exercise protocol. So being active and doing regular exercises is important, not only in pregnancy, but most important also in the postpartum period, where a woman might feel tired because of the time she has to spend with the baby, waking up late all over the night and all. But she has to adjust her lifestyle so that she can concentrate for some time on herself and do active exercises so that she can lose that amount of weight. So the postpartum weight retention is a very important issue because it has two major problems. Not only during it happens, she will be associated with more complications in the next pregnancy as well as in the much later in life. So like I already said, the pre-gravid weight is what is very, very important. So preconceptional care also includes bringing a woman to the appropriate weight. Then you also advise her regarding how to continue to have an appropriate weight gain during her pregnant status. And most important is how to get rid of her weight in the postpartum period. So if there is a postpartum weight retention, how to address it. That is, these are the things, these are different phases where a woman can have a long-term consequences. And what are the long-term consequences? I told you that in the next pregnancy, you have, unless you're concentrating on a inter-pregnancy period on her, she's concentrating on her weight and then losing it, then she is going to have an increased complications like diabetes, hypertension, and lipid abnormalities in a future pregnancy. And later on, her increased BMI is going to accumulate more fat, more visceral fat especially, and leading to a higher risk of developing type 2 diabetes, cardiovascular disease, metabolic syndrome. We all know what are the consequences of obesity, and obesity is a pandemic which is happening over the, it's spreading so fast and so vast that it has to be seriously addressed especially in pregnancy. So you have to give her lifestyle advice, control the weight, diet, exercise, and postnatal follow-up. Also, you have to, like I already told you, check her blood pressure, check her albumin, do her blood plasma glucose. So, and you also have to see if the patient is having some thyroid abnormalities. You have to look at her thyroid functions as well as the T2 antibodies, and or follow it up even much later. So, and other and also look at her lipid profile. So these are the different things that we have to advise her, and this is an opportunity for you to also address certain issues, like for example, she's having a cancer survey. I mean, you want to do a screening by pap smear. That's an opportunity for you to advise her to go for a pap smear after 3 months. Then you also can advise her, that is preventing her from having a cancer cervix. That's an opportunity for you. You can start vaccinations if she has already haven't taken, especially of, whether it's cancer cervix or any other vaccinations which are due for her. She can go ahead when she is after 3 months or so. So these are all the things that you can address in a woman's health whenever she comes to you in the postpartum period. So your responsibility starts in the preconception period. It goes through the antenatal period, and the follow-up that's counseling you do in the postnatal period, whether it is regarding contraception, whether it is regarding the complications she already had, or whether it is regarding the future pregnancy, or whether it is regarding the long-term consequences where she is likely to develop diabetes, hypertension, metabolic disease, lipid profiles, cardiovascular risk, cerebrovascular risk, stroke. So many diseases are there which she can be prone to. And I always say that women have this opportunity in pregnancy where it is telling us that this woman is at higher risk. So please take care of me. So that's an advantage they have, that pregnancy is a stress test for them. That's what it is, something like especially for some women. Actually, as far as the psychological consequences, the changes of adaptation of a woman towards a pregnant, like we say, adolescence is a adaptation from childhood to adulthood. So also there is a new term known as matrescence, where a woman in matrescence means the woman is adapting to her by psychological or hormonally to what she has to go through in a pregnancy. So these are all things that can be addressed in the postnatal period. And there are other diseases which are little rare but can happen. For example, the thrombosis which happens in women, especially in pregnancy, especially in women who are associated with preeclampsia. They have a future risk of developing thrombosis, and you know the risks of thrombosis can be cerebrovascular or cardiovascular or pulmonary. So there are other, like thyroid, I already said, yes, especially women with TPO antibodies, they can develop long-term thyroid dysfunction. So they have to be followed up with and screened for any risk of hyper or hypothyroidism. Then you also have the liver diseases like intrahepatic cholestasis. These are the women who had intrahepatic cholestasis of pregnancy. Women are at higher risk of developing hepatitis, cholelithiasis in future, and they should go for a proper screening. Women who suffer with acute fatty liver of pregnancy, it may also develop something known as a HELP syndrome in the next future pregnancies. These women with either AFLP or HELP in the pregnancy, where the damage is done to the liver, they can have a notable liver disease. So you have to warn them that any chance, any risk, any symptom they recognize, or a regular follow-up for both their liver function as well as their is very important in women who had liver issues in pregnancy, like HELP, like FLP, like intrahepatic cholestasis of pregnancy. So like I already said, there may be pre-existing conditions which you may have to address again and again in this group of women. So to see that what the harm pregnancy has done to them,